officer in mental health nursing. There are many investigations which are done even in the psychiatric setup to rule out the concurrent disorders along with the psychiatric disorders if there are any other medical disorders which are going to help in the diagnosis as well as the treatment of the psychiatric disorders. So let us see the investigations in psychiatry. Investigations are useful to detect the alteration in the biological functioning and also to rule out the medical disorders which are causing the psychiatric problems. There are various medical disorders which will contribute to the psychiatric disorders. Say, for example, we have endocrine related disturbances, okay, so thyroid problems or hypothyroidism, which is closely associated with depression. So, like that, medical disorders can also cause the psychiatric problems. To rule out the medical disorders and to plan the treatment, we are supposed to do certain investigations in psychiatry. So let us see the classification of the investigations. So number one, we have got the routine investigations which are done, as a baseline. The second one, we have got electrophysiological tests. The third thing we have as brain imaging tests. We have got the neuroendocrine tests as well as the genetic tests. Let us see the first one, which is the routine investigations. So in the routine investigations, we are having the complete hemogram that has to be done, which includes the level of the HB that we need to know, the total differential blood count as well as the ESR. So these are the baseline information that is very much required to administer any kind of the drugs, right? To find out if the patient's blood chemistry is in balance. And also we have to do the urine analysis, the routine urine analysis to find out, to rule out to rule out any kind of disturbances in the urinary system. There are times when we administer the psychotropic medications as the side effects. There may be changes in the blood chemistry. One of the example is when we administer the antipsychotic medication clozapine for treating the schizophrenia, there will be an alteration in the WBC count leading to leukopenia or agranulocytosis. So to rule out that, we need to have a frequent monitoring of the WBC count to prevent the chances of the agranulocytosis. So even that time, we will ask the patient to undergo this routine investigation. So other drugs, like when we administer the drug lithium for treating many conditions, when we administer the drug to treat the neuroleptic malignant syndrome. So all these are also going to cause the leukopenia. So very much important that you have to monitor the blood chemistry of the patient before administering the drug as well as when the patient is on the drugs. The next examination that you're going to do in the routine examination is the renal function test when the patient is on the drug lithium. You're going to do the liver function test for all the alcoholic patients when the patient will be put on these group of drugs like carbamazepine, valproate group of drugs. So these drugs, when we administer, you may have to do the liver function test because it may interfere with the liver function. You may have to do the serum electrolyte test, okay, in case the patient is having the side effect, okay, of dehydration. There may be alterations in the electrolyte level. When the patient is on these group of drugs like lithium antipsychotic medications, carbamazepine group of drugs, even then there may be alteration in the electrolyte level causing the dehydration. So that time also you may have to ask the patient to have serum electrolyte tested. Blood glucose test that we will be routinely asking the patient to do if the patient is about 35 years of age, okay, to rule out any alterations in the glucose level. You will be asking the patient to undergo a thyroid function test. Okay, so thyroid function test is very, very important. You may understand the patient with depression is associated with hypothyroidism. So to rule out that, to make your diagnosis apt, you may ask the patient to have the thyroid function test done. And also, when the patient is on treatment with the lithium and carbamazepine group of drugs, there may be alterations in the thyroid function. The next investigations that you may have to routinely do is the ECG, electrocardiogram, in patients who are more than 35 years, and also in patients who are on these group of drugs like psychotics, antidepressants, lithium. So those patients can also be asked to do the ECG, can cause the alterations in the cardiac system. HIV testing in the drug abusers, and also suggestive sexual history, and people with AIDS, to rule out that we will be asking the patient to undergo the HIV test. The VDRL test, if the patient is having a suggestive sexual history, then you may ask the patient to undergo the VDRL. The next investigation in the routine examination is the serum CPK, that is the creatinine phosphokinase. In case of the neuroleptic malignant syndrome, this serum CPK will be elevated. So you need to rule out the CPK levels, creatinine phosphokinase. Chest X-ray should be done before doing the ECT. So why is this? Because during the ECT we'll be giving certain medications, muscle relaxants. We may give some medications for the ECT procedure. So you need to be aware the patient is not having any kind of respiratory related problems. You ask the patient to undergo the chest X-ray. When the patient is on certain drugs, so very important that you need to frequently monitor the blood levels of these drugs. So to find out the toxicity of these drugs in the blood, and also the drug compliance, how well the drug is working in the patient. To rule out that, the patient may have to undergo this. The patient may have to undergo this drug level estimation. So especially if the patient is on the lithium, okay, to rule out the therapeutic level of blood lithium level, as well as the toxic level of the blood lithium, okay. So it can help us to prevent the lithium toxicity. So very much important, it has to be monitored frequently for the blood lithium level, for the therapeutic dose and the toxic dose. Other drugs like carbamazepine, the haloperidol, the imipramine, valproate, all these drugs are also going to become toxic if the drug crosses the therapeutic level. So you need to monitor these drug level estimation when the patient are on these drugs. So this is about the routine investigations that you will be doing when there is a client with the mental disorder. The next classification of the investigation we have is the electrophysiological test. So in the electrophysiological test, we have got the electroencephalogram, okay, EEG. So to rule out the conditions of seizure and the neoplasms related to the brain, dementia, stroke, metabolic and degenerative diseases of the brain. To rule out those things, so we need to ask the patient to undergo the EEG, wherein we are going to find out the electrical activity of the brain. If there are dysrhythmias, of the brain waves, you're going to rule out that by doing the EEG. The second thing what you'll be doing in the electrophysiological study is the polysomnography, or the sleep study. So here you are going to find out if the patient is having any kind of disturbances in the sleep, or if the patient is having seizure. So in those cases, you're going to find out the electrical activity of the brain, which is closely related to the disturbances of the sleep. So in those cases, you will ask the patient to undergo this polysomnography or the sleep studies. So this is about the second investigation, electrophysiological test. The third test that we are doing is the brain imaging scan. So in the brain imaging scan, you are asking the patient to undergo the CT scan as well as the MRI scan. The CT scan, it is going to rule out the CT scan, which is the computer tomography. You're going to rule out if the structure of the brain is intact. Is there any kind of a lesion, the infarction, aneurysms, or any kind of abscesses in the particular area of the brain? CT scan also helps us to rule out the changes in the anatomical structure of the brain in case of a patient with schizophrenia or organic mental disorders or bipolar disorder. So that is the use of the CT scan. The next one is the magnetic resonance imaging, which is the MRI scan. So here you will be ruling out if there are the anatomical or biochemical alterations in the areas of the brain. You're going to rule out if the patient is having any kind of neoplasms or infections of the brain, aneurysms or brain edema, demyelinations in certain cases, which will aid in the diagnosis of dementia and the schizophrenic conditions. So this is about the third classification of the test, which is the brain imaging scan. The next classification in the investigation is the neuroendocrine test. So in the neuroendocrine test, we have the list of these tests. So the first one is the dexamethasone suppression test. So dexamethasone suppression test is the one which is going to find out any kind of abnormalities in the adrenal glands, right? So endocrine system, the adrenal glands, the alterations in the cortisol level. So you need to find out that which is closely related to the stress and anxiety and depression. So that is what you're going to check in the dexamethasone suppression test. The next test that we have is the TRH stimulation test, that is the thyroid releasing hormone test again. So to rule out the T3, T4, TSH level, that you are going to find out the endocrine related issues with the thyroid gland. The next one is the serum prolactin level and serum 17-hydroxy corticosteroid. So you're going to do the endocrine test to rule out these hormonal levels of prolactin. The last one which we are doing is the serum melatonin level test. So you're going to find out if there is an increase or decrease level of the melatonin level in the serum, which is closely associated with anxiety disorder or sleep disturbances. The last investigation that we have, the classification of genetic tests. So in case of there is a child with a mental retardation, okay, so in those cases you need to do some genetic tests, cytogenetic tests that will be done to rule out the risk of the mental retardations or the chromosomal abnormalities. So this is all about the investigations that we commonly do in the field of psychiatry to rule out any kind of medical disorders which are associated with the psychiatric disorders or the medical disorders which can cause the mental disorders. Hope you all have understood the topic.